So hello friends, welcome back to my channel. Now I'll talk about the very few points regarding the mechanism of action of the noradrenaline or the norepinephrine. Okay. So the main topic for now, that is the mechanism of action of norepinephrine. Okay. How does the norepinephrine works in our body? About that thing I will talk about right now. Okay. So first of all, see the norepinephrine. It is having the receptors on alpha 1, alpha 2, beta 1, and within the beta 2 it is less potent. That means the activity on the beta 2 receptor for norepinephrine, that is much more lesser with respect to alpha 1, alpha 2 and beta 1. Okay. Now once the norepinephrine that will work on the receptors of the alpha 1, what do we know? That will cause the vasoconstriction. That will cause the vasoconstriction. Vasoconstriction. Once the vasoconstriction will be over there, as a result we get to see the increase in what? Diastolic blood pressure. Diastolic blood pressure. So here the diastolic blood pressure that will increase. In the same way, the norepinephrine is also having the receptors on where? Beta 1. And as you know, the beta 1 that is present on the heart. So what it will do, it will work over here and it will increase the heart rate. Whenever the heart rate that will be increased, so try to understand the contractions of the heart, ultimately the cardiac output that will be increased. So whenever the cardiac output, this type of the thing that will get increased, as a result the systolic blood pressure, I am writing SBB, that means systolic blood pressure, that will be also elevated. Now if you are using the drug norepinephrine, as a result we are getting to see that the diastolic blood pressure that is also getting increased, the systolic blood pressure that is also getting increased. So ultimately the mean arterial pressure, that means the systolic blood pressure minus the diastolic blood pressure, ultimately the mean arterial pressure that will get increased. Okay. Once the blood pressure that will be increased, our body is having the sensations from the what? Parasympathetic nervous system. Once the diastolic blood pressure, or we can say the mean arterial pressure, for example, that will be increased. As a result, for example, okay, let me write it over here. The mean arterial pressure that will be increased. Whenever the mean arterial blood pressure that will be increased, okay, as a result we'll get to see the parasympathetic activity of our body that will be increased. So parasympathetic activity that will be increased. Once the parasympathetic activity that will be increased, it will release what? It will release acetylcholine. Once the acetylcholine that will be released, that will work where? The receptors for the the cholinergic neurons, that is the receptor were within the M2. So the acetylcholine that will work on the M2 that is present on the heart. As a result, it will decrease the heart rate. Right? Now try to understand, once the mean arterial blood pressure that will be increased, the parasympathetic activity of our body that will be also elevated or increased. As a result, it will secrete what? Acetylcholine, and acetylcholine is having the receptor on the heart, that is nothing but the M2. Once the M2 that will be activated, that will decrease the heart rate, and this thing that is known as a reflex bradycardia, or reflex bradycardia. Reflex bradycardia. Okay. Now there is a drug that is known as atropine. So if we use atropine, this atropine is having the inhibitory functions on the M2. So whenever we are using the atropine, this atropine that can block the what M2 receptor that is present on the heart. And what was the function of the M2? To decrease the heart rate, right? Now once we use the atropine, that means, for example, what I want to say you, that if we use, for example, if we use the norepinephrine plus atropine, what kind of the thing we'll get to see whenever we're using the norepinephrine, right? So here the heart rate that is getting decreased by the action of what? Reflex bradycardia. But the atropine that will antagonize the function of the M2 receptors. So ultimately the heart rate that will keep on rising. So the heart rate that will be increased over here. Okay. So it's the normal function of the atropine. Now here the heart rate that was decreased, here the heart rate that will get increased, right? Now if we talk about little bit about the adrenaline. So what kind of the thing we'll get to see as far as the adrenaline is concerned. Okay, and the adrenaline is having the receptors for alpha 1, alpha 2, beta 1, beta 2. So whenever the alpha 1 that will be activated, that will cause the vasoconstriction, and as you know the functions for the beta 2 for the vasodilations, right? Now once the vasoconstriction part will be over here, the blood pressure that can be elevated. Okay, and once the vasodilation that will be over here, the blood pressure that can fall down. This is a normal thing, okay? And we are going to use only 0.3 to 0.5 ml adrenaline in the form of 1:1000 solution or dilution, we can say over here. And of course you have to use intramuscularly. You have to use intramuscularly in case of anaphylactic shock. Okay, in case of anaphylactic shock. So this was the short video regarding the function of or the mechanism of actions of the adrenaline and the noradrenaline.